Hello everyone, welcome back to our channel. As we get older, especially for those of us over 50, keeping an eye on our health becomes even more important, and understanding the warning signs of diabetes is a key part of that. Many people don't realize that diabetes can reveal itself through nighttime symptoms that are often easy to overlook. These symptoms may seem insignificant at first, perhaps just a bit of discomfort or disturbance in your sleep, but they can be early indicators of something much more serious happening in your body. Ignoring these signs could lead to long-term damage, particularly to vital organs like your kidneys, which are highly sensitive to changes in blood sugar levels. In today's episode of Healthy Care Over 50, we're focusing on the critical nighttime signs of diabetes that you shouldn't ignore. If you're waking up frequently during the night, experiencing unexplained changes in your sleep patterns, or noticing other unusual symptoms, these could all be red flags that your body is struggling with high blood sugar. Recognizing these signs early on can help you take proactive steps to manage diabetes and prevent it from causing more severe complications down the line. This video is about empowering you with the knowledge to catch diabetes symptoms before they worsen and negatively impact your quality of life. By understanding what to look out for at night, you can protect your kidneys, preserve your health, and get ahead of any potential issues. Stay tuned as we explore these warning signs in depth and provide practical tips on how to manage them. Let's take control of our health and well-being, especially when it comes to something as important as diabetes. 1. Frequent nighttime urination. Nocturia, or frequent nighttime urination, is a common sign of high blood sugar levels in people with diabetes. When blood sugar rises, the kidneys work overtime to eliminate excess glucose by pulling more water into the urine, leading to frequent urination. This disrupts sleep and is often an indicator that blood sugar levels are dangerously high. Over time, this strain on the kidneys can lead to chronic kidney disease, a serious complication of poorly managed diabetes. I remember a patient who woke up nearly 10 times a night to urinate, leaving him exhausted during the day from lack of proper sleep. After identifying the root cause, we were able to address his issue, and within 3 days, he was finally able to sleep through the night. Excessive urination can also lead to dehydration, worsening other health problems like dizziness, dry skin, and sluggish digestion. This type of dehydration often sneaks up slowly because the body prioritizes getting rid of excess glucose. Many people don't connect the dots between frequent urination and dehydration, but this combination can drive downstream symptoms like extreme thirst. If left unaddressed, the dehydration can affect the function of vital organs such as the kidneys and liver and lead to electrolyte imbalances, which may cause complications like irregular heartbeats or sudden drops in blood pressure. 2. Excessive thirst. Excessive thirst, also known as polydipsia, is the body's response to dehydration from frequent urination. As blood sugar levels rise, the body retains sodium, leading to a cycle where you drink more water, urinate more often, and lose critical minerals like potassium, magnesium, and calcium. The sodium levels remain high, further complicating the situation. This unquenchable thirst is a sign that your body is severely dehydrated, but drinking water alone doesn't solve the problem because the body continues to lose fluids through excessive urination. This leads to a dangerous loss of electrolytes, which are essential for muscle function, nerve signaling, and even heart rhythm. In one case, a person continued drinking water to no avail, losing more fluids and minerals, making their condition worse without realizing it. Sodium retention caused by diabetes can also lead to high blood pressure, increasing the risk of cardiovascular diseases. The cycle of drinking more, urinating frequently, and depleting electrolytes makes it hard for the body to regain balance without medical intervention. 3. Restless leg syndrome. Restless leg syndrome, RLS, can be a subtle but distressing symptom of diabetes. This is something I personally experienced when I was eating a pint of ice cream every night. The excess sugar in my diet depleted my body's vitamin B1 stores, leading to a buildup of lactic acid in my muscles, which made them feel restless and fatigued. In addition to a vitamin B1 deficiency, a lack of magnesium can also contribute to RLS. Without enough magnesium, muscles can't fully relax, making the discomfort worse. Restless leg syndrome can severely disrupt your sleep, as the urge to move your legs is often accompanied by uncomfortable sensations like tingling or aching. Many don't realize that RLS is often linked to nutrient deficiencies. Excess sugar in the diet rapidly depletes thiamine, vitamin B1, causing lactic acid to build up in the muscles. This, combined with magnesium deficiency, creates the perfect storm for restless legs. Addressing these deficiencies through diet and supplements can significantly improve symptoms and help you get a better night's sleep. 4. Peripheral neuropathy. Peripheral neuropathy is another serious complication of diabetes, and it usually affects the lower extremities, especially the feet. Symptoms like burning, pain, numbness, or strange sensations tend to worsen at night when lying down. This happens because high blood sugar levels damage the blood vessels that supply the nerves with oxygen and nutrients, leading to nerve inflammation and malfunction. One effective way to manage this is by supplementing vitamin B1 with alpha-lipoic acid, a powerful antioxidant that supports nerve regeneration and reduces discomfort. If untreated, peripheral neuropathy can result in infections, ulcers, or even amputations in severe cases. Supplementing with vitamin B1 and alpha-lipoic acid can improve blood flow to the nerves and reduce inflammation, slowing the progression of the condition and providing symptom relief. 5. Cramping in the lower legs or feet. Leg and foot cramps, often caused by magnesium deficiency, are another painful and disruptive symptom of high blood sugar. Magnesium plays a key role in muscle relaxation, but when magnesium levels are too low, calcium builds up in muscle cells, causing involuntary contractions and cramps. These cramps are more common at night due to reduced blood circulation and muscle tension. Magnesium glycinate is a highly absorbable form of magnesium that not only helps prevent cramps but also promotes better sleep. By relieving the cramps and relaxing the muscles, magnesium can significantly improve sleep quality, which is essential for people dealing with diabetes-related symptoms. 6. Excessive sweating at night. Night sweats are a surprising yet common symptom of diabetes. This is not the same as menopausal hot flashes, it's a result of blood sugar fluctuations that activate the body's stress response, also known as sympathetic dominance. Both low blood sugar, hypoglycemia, and high blood sugar, hyperglycemia, can trigger this excessive sweating, as the body struggles to manage blood sugar levels. Night sweats are a clear sign that your blood sugar management is out of balance. Whether it's due to low or high blood sugar, the body responds with excessive sweating, especially around the face, neck, or upper body. If this happens regularly, it may be time to reevaluate your blood sugar control strategies, such as adjusting your diet or medication. 7. Sleep apnea and diabetes. Sleep apnea is commonly linked to diabetes, particularly due to insulin resistance and the weight gain that often accompanies it. As the body becomes more resistant to insulin, it compensates by producing more insulin, which can lead to weight gain, especially around the neck and upper body. This extra weight can obstruct airways, leading to interrupted breathing during sleep. Sleep apnea not only decreases the quality of sleep but also worsens insulin resistance, creating a vicious cycle. People with untreated sleep apnea often feel fatigued during the day and are at higher risk of developing cardiovascular issues. Managing both sleep apnea and blood sugar levels is crucial for breaking this cycle. 8. Hypoglycemia, low blood sugar, at night. Hypoglycemia during the night is another issue that can cause sudden wakefulness. When there's too much insulin in the bloodstream, it can cause blood sugar to drop too low, prompting the body to release stress hormones like adrenaline and cortisol to raise blood sugar back up. This can cause you to wake up abruptly, feeling anxious, shaky, or sweaty. Controlling nighttime hypoglycemia requires careful blood sugar management, often through a low-carb diet. However, this can take several months to balance. Sometimes the liver's overproduction of glucose due to past dietary habits complicates blood sugar regulation. 9. Melatonin and high blood sugar. High blood sugar can delay the release of melatonin, the hormone responsible for regulating your sleep-wake cycle. Normally, melatonin levels rise in the evening, signaling the body that it's time to sleep. However, elevated blood sugar disrupts this process, making it harder to fall asleep even if you're tired. Stabilizing blood sugar levels can restore normal melatonin production and improve sleep quality. 10. Gastric reflux, GERD, and diabetes. High blood sugar can also lead to gastric reflux, or GERD, due to the dysregulation of the autonomic nervous system. When blood sugar is elevated for prolonged periods, the muscles that control the opening and closing of the valve at the top of the stomach can become affected, leading to acid reflux, especially when lying down. Adopting a low-carb diet and adjusting meal times can help reduce this issue, improving digestion and sleep. 11. Nightmares and vivid dreams. Some people with diabetes may experience nightmares or vivid dreams, which are often linked to a vitamin B1 deficiency. Consuming too many carbohydrates or having uncontrolled diabetes can deplete your body's stores of B1, a nutrient essential for proper brain function and sleep regulation. Without enough B1, the brain can misfire during sleep, leading to more intense dreams or nightmares. In these cases, replenishing B1 through diet or supplements may help reduce these nighttime disturbances. 12. High blood pressure at night. Another issue that affects people with diabetes is high blood pressure at night, a phenomenon known as non-dipping. Typically, blood pressure should decrease during sleep as the body relaxes, but in people with diabetes, this doesn't always happen. Instead, blood pressure may remain high, putting extra strain on the cardiovascular system. Over time, non-dipping can lead to a higher risk of stroke, heart disease, and other complications related to high blood pressure. 13. Teeth grinding. Teeth grinding, or bruxism, is another problem that can be triggered by diabetes, particularly due to the activation of the sympathetic nervous system. When blood sugar levels are poorly managed, the body enters a state of stress, activating the fight-or-flight response even during sleep. This leads to tension in the jaw muscles, causing you to clench or grind your teeth, often without realizing it. Over time, bruxism can damage your teeth and lead to jaw pain or headaches. 14. Waking up with a headache. Lastly, waking up with a headache is a common complaint among people with diabetes, and it's often due to dehydration. When blood sugar levels are high, the body loses more water through frequent urination, which can deplete essential electrolytes like sodium, potassium, and magnesium. Simply drinking water might not be enough to rehydrate effectively, you also need to replenish these electrolytes to maintain proper fluid balance in the body. Without enough electrolytes, the brain can become dehydrated, leading to headaches and difficulty concentrating. So there you have it, the 14 symptoms of nighttime diabetes that you should be aware of. Managing diabetes isn't just about keeping an eye on your blood sugar levels during the day, it's about recognizing the impact it can have on your sleep and overall health at night. From frequent urination and dehydration to sleep apnea, restless legs, and even headaches, these nighttime symptoms are important signals that your body needs help. By making the right lifestyle changes, like adopting a low-carb diet, supplementing with key nutrients, and taking steps to regulate blood sugar, you can dramatically improve your sleep and your health. If you found this video helpful and want more tips on how to live a healthier life over 50, be sure to subscribe to Healthy Care Over 50. Don't forget to hit the notification bell so you never miss out on our latest content. Your health is worth it, let's take control together.